Hello, this is Dr. Anthony Arian. I want to discuss how a diabetic should care for his feet to avoid amputation. Amputation of the feet is difficult even for a doctor to recommend to any patient, but usually offered when it's the last resort to save the life of the patient. In a diabetic, someone with blood sugar regulation problem, there are a lot of reasons why their feet are at risk of being amputated. One, many of them suffer loss of sensation on the feet, such that minor injuries that should have been promptly treated are not known of until it has become complicated. Also, there's problem with joints between the small bones of the feet, such that the feet loses its ability to absorb shocks. All this predispose a diabetic to foot complications. When these injuries happen, it is easily infected because the elevated sugar in the blood makes it easy for infections to thrive and delays wound healing. So, if you are a diabetic or you have a loved one who is diabetic, this video is for you. You need to know how to care and protect your foot from the risk of being amputated. What do you need to do? 1. Good control of your blood sugar is about the most important for diabetic to avoid complications, because this is the basis of the disease itself. So, adhere to the diets and medications that have been recommended for you, and keep up with your medical checkups for frequent assessments by your doctor. Secondly, you should frequently check your foot for any injuries, and any injury noticed, no matter how small it is, should be taken serious and managed appropriately. Avoid wearing tight-fitting shoes. This can cause swelling of the feet and can cause minor bruises that can deteriorate into major problems on your feet. It is recommended that a diabetic should wear a slightly oversized footwear that will be relaxed on his foot to avoid injuries. All pedicure should be carefully done to avoid injuries while cutting the nails, as these minor injuries on the foot of a diabetic can cause devastating complications. If, despite all these measures, a diabetic develops injury to the feet, infection, or loss of ability to sense feeling on the feet, this should prompt immediate assessment by a doctor and appropriate measures taken. Despite all this, occasionally a diabetic can come down with devastating infection of the feet, for which a doctor recommends amputation. This may range from removing one or multiple toes to removing the foot from the ankle and going upwards up to the knee or more. Usually, the smallest part needed to be removed to save the foot or the life of the patient is recommended. However, when patients decline consent, these infections can rapidly ascend along the feet, leaving them with need for more major amputations. It's understood that amputation is a life-changing procedure and not easy for anyone, but because it's not usually likely recommended without strong indication, it's advised that when indicated, a patient should not delay giving consent, because more complications, including death, is possible. This is to create awareness of these minor measures that can reduce risk of coming down with conditions that may warrant amputation. And let me state that doctors don't enjoy removing body parts except when indicated. Do not, for fear of amputation, choose to run to alternative medicine where even your life is in bigger risk. And this is Dr. Anthony Arion, adding to health and social literacy. Thank you.